The Ontario government will bar international students from the province's medical schools beginning in 2026. Premier Doug Ford announced today that 95% of spots will be reserved for Ontario students and 5% for students from other parts of Canada. He spoke earlier today in Oshawa.
This has been gnawing at me for years, as my colleagues know. I found out because you'd go out to events and I'd say, how are the kids? Well, they're studying in Ireland, or they're studying in the Caribbean, they're studying in the US. And what happens? They meet someone and they don't come back home. So I've just been all over our Minister of Colleges and Universities, and there was 18% students from around the world taking our kids' seats and then not even staying here and going back to their country. And it's just not right. So now it's going to be 100% Canadian, 95% Ontario.
The number of international students studying medicine in Canada is quite low. The Association of Faculties of Medicine of Canada lists 9 first-year students enrolled this year across the country. Ford also announced that starting in 2026, the province will cover the tuition for 1,300 medical students who commit to becoming family doctors in Ontario. Let's welcome my next guest, who has firsthand insights into why Ontario's medical students shy away from family practice. Dr. Cathy Risdon is the chair of the Department of Family Medicine at McMaster University and a practicing doctor. She joins me this evening from Hamilton. Let me get your first thoughts on these changes.
Yes, well, as you mentioned, the number of international students in medical schools really isn't an issue in Ontario. The proposal to support tuition for students who commit to family medicine practice after they graduate is a welcome signal that the government understands what a crisis we have in family medicine, and it's a step in the direction of making sure the 2.5 million Ontarians without access to a family doctor may someday have one. But I have some concerns about this strategy, and I don't think it addresses the number one reason why we don't have enough comprehensive family docs in Ontario right now.
Do you think that these changes will encourage more Ontario students to pursue careers in family medicine?
We know the formula for getting folks attracted to family medicine. You bring bright people into med school, which we're doing a good job of now. You give them a great exposure to family medicine as part of their medical school training. You bring them into a great training environment to prepare them for practice. All of that we're doing a pretty good job of right now. The big problem is the environment that we send them into after training is crushing, and folks who enter it leave it soon. People retire from it early, or people avoid going into it altogether. So, I worry about a 20-year-old new medical student who actually hasn't had the chance to taste all of the different elements of medical practice. It's hard to make a lifelong career decision in your first month of medical school. And to feel the pressure to do that based on financial reasons, I think won't solve the problem in the long term. We definitely want to support a diverse group of medical school applicants, make medical school accessible. And I think there's ways of looking at tuition forgiveness after someone's made a career choice. But I first of all worry about forcing that kind of decision so early in training. And again, it distracts us from the real issue, which is supporting a practice environment that is sustainable and that makes people want to stay in the profession.
I mean, what are your students telling you? Because there seems to be a hesitancy amongst students to go into family medicine.
Yeah, there's sort of 3 parts of the pipeline, right? We get the students in, we expose them to family medicine, and we're doing all we can to ensure that the medical school environment really demonstrates how important family medicine is to the healthcare system and what a rewarding career it is. And we attract some very good people into our residency program. And what they tell us is they love the medicine. They love being a family doctor. They love working in a clinic with teams in a collegial environment. And if they could have that for the rest of their career, they'd be thrilled. The problem is once they finish training, that is not available to many of them. And ones who are practicing right now in comprehensive family medicine are telling us that the practice environment is crushing and they feel they need to leave. So we have to retain those who are practicing family medicine, and we have to make an enticing practice environment for those who've chosen to train in family medicine, but leave our training programs and practice in focus practice in hospitals, in sports medicine clinics, anything but the comprehensive family medicine that we know Ontarians need.
So what would you like to see the government do moving forward here to, as you say, really encourage new graduates to go into family medicine once they leave residency?
Exactly, yes. So our learners have told us everything they'd love to see. They want to continue to practice in teams because they know that's great for patients. It's great for the sustainability practice. It's collegial. It's what folks enjoy. They want the administrative burden of medicine to be addressed. So everyone says, I love the medicine of family medicine. It's the non-medicine that's killing me. And the non-medicine really is those hours spent chasing down referrals. So let's create a centralized referral system. That would be a big step in the right direction. We've heard a lot about sick notes and paperwork and insurance forms, and there's some efforts to address that. We could do more there. New grads don't want to be small business owners. They would love a turnkey operation. They obviously understand that's an investment they need to contribute to, but they'd love to have settings where they can move in and start being comprehensive family doctors without having to worry about leases and supervising staff and the costs of salaries and the overhead of family medicine, which is really becoming a big challenge. Those things would make a huge difference to retaining people in family medicine, making our new grads excited to practice comprehensive family medicine. And the word goes upstream pretty fast. And when new grads say, hey, I'm having a great life, I feel well supported, this is a fantastic career, the medical students end up choosing family medicine as well. So there's a lot we can solve on the medical school side by improving the practice environment side.
All right. Well, thank you so much for your time and your perspective on this. That is Cathy Risdon. She's the chair of the Department of Family Medicine at McMaster University and also a practicing family doctor.